In dentistry, a solo act just won't do. The mouth isn't an island, it's deeply connected to overall health. That's why an interprofessional approach is becoming increasingly important. This means dentists work together with medical professionals, accountants, and others to provide a comprehensive and coordinated plan for each patient's well-being. Welcome to Beyond the Drill, a multidisciplinary approach to oral health. To get a well-rounded view of dentistry, I spoke with 5 specialists from different fields in this video. These are Richelle May Tabigny, a 23-year-old currently working in food and beverage company; Mervin Licanda, a 27-year-old, a registered medical technologist; Stephanie Glenn Olya, a 23-year-old, a registered nurse; Teresa Tomales, a 22-year-old, graduate in BS Biology; Joan Tessalona, a 23-year-old, and graduate in accountancy. Briefly describe your understanding of dentist's role in the healthcare system.
Hi, good morning. I am Rochelle Maytabigni. I am 23 years old and I currently work under the food and beverage sector.
Good evening, everyone. I am Mervin Licanda, 26 years old, a registered medical technology.
Hi, I'm Stephanie Glenn and I am 23 years old and I am a nurse.
Hello, good morning. My name is Teresa Tomales. I am 22 years old, a BS biologist.
Hello, my name is John Sigfred Tasaluna. I am 23 years old and a fresh grad sa kursong BS Accountancy from NU Asia Pacific College.
How does a dentist's understanding of oral biology contribute to overall patient health? Connect your profession.
Oral health is an important part of the overall healthcare sector, and the role that the dentists play in the healthcare system is very important, since they are the ones in charge of making sure that the Filipino citizens are up to date with their oral healthcare, that they are doing the necessary practices in order to maintain their oral healthcare, and to help Filipino citizens tackle problems, whether minor or major, in terms of their oral health.
Dentists are primary healthcare providers who diagnose, treat, and prevent oral diseases. They play a crucial role in maintaining overall patient health by ensuring proper oral hygiene and function.
For me, they play a crucial role in the healthcare by diagnosing, preventing, and treating oral health issues such as tooth decays, gum diseases, and other oral infections. Next,
I really do think that dentists play a crucial role in the healthcare system, as they are the ones who promote our oral health. Dayon sila po ang nag-diagnose o nag-treat sa atong oral diseases and conditions, as well as preventing mga dental issues by conducting mga regular check-ups and cleanings, and kanang sila sad ang naga-provide og kanang or naga-educate sa atua on what is the appropriate nga oral hygiene practices.
No? Para sa ako, crucial ang role sa dentist sa ato ang healthcare system, since sila ang naga-diagnose and naga-treat sa mga oral diseases, mga na oral problem, and sila pud ang nag-promote sa oral hygiene. And big help pud sila sa mga tao nga naay mga insecurity sa ilang kaugalingon, sa ilang teeth ba or sa ilang pag-smile, and with them daw kay sila tabang ana.
It is important for a dentist to understand the overall oral biology of a person, because as people who aim to address the problems that the humans encounter in terms of oral health, it is important to know the oral biology of a human, because it would be the key to doing a root cause analysis and understanding where the problem is coming from and what solutions are needed in order to take care of the root problem, so that it doesn't branch out to other problems that could complicate the entire body because of poor oral health. And as someone who works in the food and beverage sector, I know firsthand how important it is for us to take care of our mouth because of our oral health care. Because this could oral health care could lead to deeper, more entrenched branches of discomfort and problems, especially since as people who enjoy food, we have to process it through our mouth. And then if you're suffering, say, from problems in our mouth that affect our taste, our ability to consume the food that we eat, it would really deeply impact our overall health.
A dentist's understanding of oral biology is vital because the mouth is a gateway to the body. Oral health issues can be linked to systemic conditions like diabetes, heart disease, and even pregnancy complications. By identifying oral problems early on, dentists can potentially prevent or manage these other health concerns. My background in medical technology, particularly in areas like microbiology and immunology, allows me to understand the link between oral pathogens and systemic diseases.
As a nurse, aside from providing quality care to patients, we also do health teaching basing on the needs of the patients as we assess them. So dentists, on the other hand, also educate patients on proper oral hygiene practices. Overall, dentists contribute to the overall health by addressing oral health concerns that can impact the systemic health. Next.
Now, understanding oral biology helps dentists in diagnosing oral diseases and conditions more accurately. For example, knowledge on the anatomy of our gums and teeth kay makahelp in identifying issues like cavities or gum diseases, which will allow for a timely treatment and management para ma-prevent ang paglala sa disease and para ma-alleviate ang na-feel sa ato ang patient na discomfort. Now, as a biology student, I can really relate to the importance of understanding the intricate na biological processes kay kanang it is relevant magod in comprehending oral biology and its implication for overall patient health.
Para sa ako, essential kaayo ang ilang understanding, no? Since it allows them to identify potential oral health issues, and with that makakuan sila kung unsay maayo nga treatment. And as an accountancy graduate, my profession emphasizes analytical skills and attention to details, and siguro agian na dako po na siyang tabang sa pag-understand when it comes sa sa system sa oral biology and sa impact pud ana sa overall health.
Outside of patient care, have you ever collaborated with a dentist in a professional setting? Yes or no? If yes, please elaborate on the context and your contribution. If no, please mention possible scenario your contribution helps a dentist in a professional setting.
I have not yet had the chance to collaborate with a dentist outside of the profession.
Even though I haven't directly collaborated with a dentist yet, my skills in analyzing blood tests, performing microbiological tests, and understanding infectious diseases could be valuable in settings like identifying patients at risk for oral infections based on laboratory findings, or monitoring patients undergoing dental procedures that require immune system support.
I have not yet collaborated with a dentist, but I'm looking forward to one.
Now, unfortunately, I haven't really done a collaboration. I haven't really done a collaboration with a dentist in a professional setting, like doing research or surveys for educational purposes, because my research or my thesis like now it is more, or it focuses more on the environmental sciences, like the interaction between phytoplankton and microfiber. But a background in biology can really help me in comprehending the complex interaction of our kanang oral nga microbiota and our dental health, which is really essential in diagnosing pod and in treating conditions. And also, kanang one contribution sad nga ako ma-think as a biology student kay I can assist in research. So we can contribute to dental research projects by providing inputs or ideas on what appropriate experimental design that must be used for this study, also in analyzing the data and in interpreting the data. And other than that, I can also help in educating the patients as well on how important having oral hygiene practices gyud na atay kanang daily nga routine for our kanang oral health.
Para sa ako, out of patient care, I have not collaborated with the dentist in a professional manner. However, siguro ang scenario where collaboration might occur kay siguro sa part nga ang skills as an accounting student kay kanang sa financial analysis and management, so makatabang na sa pag-support sa mga dentists in managing their practices efficiently and analyzing revenue streams or sa pag-optimize sa ilang financial strategies.
In your opinion, what are some potential benefits of your profession and dentists collaborating more closely in patient care?
And I guess the benefits of a dentist working with someone in my profession, in our business. So I guess us and or people in my industry could work together with the dentists to be the bridge in terms of making the people understand the importance of healthcare, of the oral healthcare, to emphasize the importance of going to the dentist, to having their oral health checked, not just for the usual basic tooth extraction, but also in the overall maintaining of their oral health.
Improve diagnosis and treatment of oral diseases, early detection of systemic health issues based on oral health, development of more targeted preventative strategies for patients.
We could work on together by planning health education and leading seminars, raising awareness and prevention of various illnesses. As we observe sa atong locality, oral hygiene is one of the aspects of health that people tend to ignore or give less attention to. So by working with dentists or collaborating with them, with their specialized knowledge, they are more focused on, they are more masters in art sa atong oral health. So we can together encourage people to be mindful of their oral health as much as the other aspects of health. So,
I can think of some benefits, ay dagan siyang benefits if mag-collaborate ang akong profession or ang akong field, which is biology, ang dentistry, in kanang alleviating or improving patient care. So one thing that I can think of kay innovative nga provide innovative solution, like we can develop novel treatment to kanang or like preventive strategies sa ato ang patient para ma-improve ang ilaang experience bitaw, no? Like by doing research, we can discover nga mas practical din ni gamiton nga treatment kaysa sa ani for this type of patient.
So, closer collaboration, no? Between accountancy professionals and dentists. Siguro, it could lead to improve the financial management within dental practices and sa sa administrative processes, and siguro better allocation of resources and sa pag-enhance sa ilaang patient care.
What knowledge or skills that is related to your profession could be particularly valuable to dentists?
Is that as people catering to the needs of our consumers, we are deeply in touch with our consumers, with the people who patronize our products, and we communicate with them on a regular basis to discover what their needs are and how do we address that.
Blood analysis such as anemia and diabetes, hematology, bleeding disorders affecting dental procedures could be particularly valuable for dentists.
Nurses are known for its being caring and very therapeutic sa pag-communicate sa patients. So, our passion in handling patients and mastering the therapeutic communication maybe is one of the skills that could be valuable sa dentist. Even though murag sa tanang healthcare magud kay murag kailangan mo i-master, pero sa nurses magud kay they tend to work more on the patients. They interact more kasi sa ubang nasa healthcare.
Like I said, one skill that is kanang maka-benefit yun sa dentist kay ang or like ang research skill namo, because then nga we can weigh or makabalance ita nga ang appropriate nga gamiton kung unsa ang practical and unsa ang cost effective.
Kaning siguro ang sa part nga kanang financial management, sa pag-budget and strategic planning. And siguro mo na siya particular nga ako ang maingon nga valuable to dentist, since makatabang na ning mga skills para sa pag-optimize sa ilang practice and sa ilang operation, and maybe pod sa ilang decision making.
What challenges do you see in fostering closer collaboration between your profession and dentist?
And the challenges I think I anticipate that would take place between collaborations of my profession and dentists is that maybe there would be a gap in terms of the knowledge that the dentists already have with what we have, and in communicating the needs that we need to tell our customers. So I guess there should be a better way to communicate and to mediate a communication and to foster a better understanding between the two professions in order to work more closely and more effectively.
Limited awareness of each other's professions and skill sets.
There are no challenges so far sa akong nakuha pa. Wala pa.
For this one, I can think of any challenges na if mag-collaborate ang akong field and dentistry
kay layo kayo ang part nga dentist dayon accounting aside, so siguro ana nga part different sa professional cultures, communication barriers since lahi-lahi ang mga terms, and establishing mutual trusts and understanding of each other's expertise and contribution.
How can your profession be applied to improve dental treatments?
Providing accurate laboratory testing for oral infections and systemic conditions.
As I've said earlier, na nurses don't focus just on the bedside care sa patients, but we also do health teaching, and dentists also, I know nga mas they also want to raise awareness regarding jud sa oral hygiene, kay lagi neglected na siya sa atong locality. So sa question, how can the your profession be okay? So if mag-collaborate ang dentists and nurses, they can come up with mga seminars regarding anong isa ka atong mga oral health hygiene practices ano.
I've said earlier nga doing research, we can collaborate para maka-provide og novel nga treatment to improve patient experience nga maka-provide basically providing novel treatment for the patient.
Sa mga accounting principles, no, kana mo'y ma-apply to improve dental treatments by analyzing cost effectiveness sa procedures and katong pag-manage sa budgets for research and development sa pudna, and kanang optimizing financial resources para sa ilang kanang patient care.
Discuss the connection between any concept that is related to your profession and to the oral health.
My knowledge can be applied to understand the role of bacteria in periodontal disease and periodontitis. This knowledge can help dentists develop more effective treatment plans and patient education strategies.
We focus on not just one aspect sa health sa among profession. We see health as a whole, pero we don't kanang ignore pod ang mga specifics ana nga whole. So dili holistic care, we have this holistic care mga going on sa amo ang field, among ina focus. So without the kaning oral health, wala ra ang meaning sa holistic care, kay wala na magyapil ang oral health. So included gud siya. So dili lang line ang amo ang gina-focus.
Now, one concept I can think of that is closely related to oral health is on the concept of microbiome. Di ba ang microbiome kay it refers to the different community of microorganisms that lives in our body, like bacteria, mga fungi nga nag-inhabit sa atong body and including sa atong mouth. My understanding of microbiology allows me to appreciate the intricate interaction and the balance within the oral microbiome and its impact on our oral health.
And concept of risk management siguro nang kay mo na siya inherent sa accounting nga side. So it can be related sa oral health by identifying risk factors for oral diseases and implementing preventive measures and managing potential complications of dental treatments siguro.
Do you have any suggestion for promoting interdisciplinary education with your profession or educational attainment and dental schools?
Joint educational seminar for dental students and medical technology students.
Maybe more on the collaboration projects and mga trainings interacting with other interdisciplinary sa healthcare, it would be good since pwede man mag-exchange knowledge ang mga profession. So if with that exchange of knowledge, we can share it to people and give them encourage them more to give importance sa ilang health. So that would be all sa mga akong answers or akong understanding aning dentistry. Thank you.
Yes. It kanang for me lang personally, I really do think that interdisciplinary education is very important kay kanang para dili lang mag-focus sa isa ka aspect kundi kanang other ideas from different fields kay ma-integrate nato when it comes to providing kanang care sa atong patient. Kay the more knowledge from different aspects, siguro I think kay mas mapa-enhance, mapa-improve nato kung unsa ang atong gamiton or appropriate na treatment para sa ato ang patient. So yes, I suggest nga there will be interdisciplinary education not only between my profession nga as a biology or as a researcher, not only that kanang bisag sa like for example like sa finances, like mga accountancy, mga accountant, important kaayo nga mag-collaborate ang mga dental schools and like accountants para pag-provide o care sa atong patient.
Siguro akong i-promote interdisciplinary education, no? Siguro mag-create of joint programs or workshops between accountancy and dental schools para ma-foster ang collaborative research projects, mga and para ma-encourage pod ang mga school or university para na-exchange program for students to gain exposure to both fields kay murag layo good siya para sa ako. So
as I end the interviews among the 5 professionals, I have realized that there are similarities and differences of their answers. For similarities, the role of the dentist, all interviewees agree dentists are crucial for oral health care, focusing on prevention, diagnosis, and treatment of oral conditions. For the importance of oral health, all acknowledge the link between oral health and overall health. For collaboration experience, all interviewees acknowledge that they haven't tried to collaborate with a dentist but propose a potential scenarios. And then the collaboration benefits, everyone sees a potential benefits from closer collaboration between their profession and dentistry, leading to a more comprehensive patient care. For the differences, they have a specific profession, so each interviewee comes from a different background: food and beverage, medical technology, nursing, biology, and accountancy. For the focus of collaboration, their responses vary in how their profession can contribute to dentistry. For the food and beverage, she explains the importance of taking a considered amount of sugars and to consider their oral health. For medical technology, he analyzes blood to test to identify a potential oral infection risk. For the nursing, she provides patient assessment, health education, and holistic care. For the biology, she offers an insight in genetics, microbiology, and pharmacology. For the accountancy, he analyzes cost effectiveness of procedures, manages budget, and optimizes resources. For the challenges to collaboration, nursing, biology, and accountancy haven't experienced challenges to to collaboration. And then the food and beverage and medtech, they said that lack of awareness and communication barriers. For the improving of dental treatment, the approaches vary based on their profession also. For food and beverage, develop new materials and enhances oral care products or foods. And then medical technology provides accurate lab testing for oral infection and systemic condition. For nursing, offers holistic assessment and promotes preventive care. For biology, it explores the connection between genetics, microbiome, and treatment option. And then the accountancy, it analyzes cost effectiveness and procedures and manages the resources. For connection to oral health, all connect a concept from their field to oral health. For food and beverage, sugar content and low sugar alternatives, medical technology is role of bacteria in periodontal disease, nursing, medication effects on oral health, biology, cellular signaling pathways and inflammation in periodontal diseases, and then the accountancy, the risk management, identifying the risk factors and preventive measures, and then the promoting interdisciplinary education. Everyone proposes ways to encourage collaboration through joint programs, workshops, or research initiatives. Dentists rely on a variety of other professionals to provide optimal care to their patients. Food and beverage professionals can advise patients on proper nutrition to promote good oral health. Medical technologies analyze blood tests to ensure patients are healthy enough for dental procedures, for example, tooth extraction. Nurses assist dentists during procedures, ensuring patient comfort and sterilization of equipment. For biologists, contribute to the research of dental materials and treatments. And for the accountant, it manages the financial aspect of a dental practice. So understanding this diverse perspective on collaboration with dentists is valuable. While everyone agrees on the importance of oral health and the potential benefits of teamwork, the specific contributions and challenges vary depending on the profession. So this highlights the need for open communication and a shared focus on patient well-being. By acknowledging these differences and actively promoting interdisciplinary education, we can break down barriers and create a more collaborative healthcare environment that leverages the strengths of each field. As I end the interview among the five professionals, I realize that their answers have similarities and differences. For similarities, the role of dentists, all interviewees agree that dentists are crucial for oral health care, focusing on prevention, diagnosis, and treatment of oral conditions. And then all acknowledge the link between oral health and overall health. For the collaboration experience, all interviewees acknowledge that they haven't tried to collaborate with a dentist, but each of them propose a potential scenario. For the collaboration benefit, everyone sees potential benefits from closer collaboration between their profession and dentistry, leading to a more comprehensive patient care.